All right, welcome to this week's live Q&A. We're going to be going over gut health. There's three major questions that we're going to be going over today. And the first one is, what are the common causes of heartburn, acid reflux, and bloating? And then, obviously some things of what to do about it. And then also we're going to go over the potential negative consequences of using antibiotics and also proton pump inhibitors, which are the acid blocking type medications, and basically what problems those can create. And then the third question we'll talk about is if you have any gut or even immune system symptoms, what are the appropriate functional medicine testing that you would want to do. And so if I'm Dr. Gunning, everybody. And so today we're doing our live Q&A. And if you do have questions as we're going along here, please, you can put them into the comments and we can get back to them. I typically end up answering them later on after we're done. But I am doing this live Q&A every week on Wednesdays, and so look out for them each week. So let's dive in here today and talk about, what are we talking about here is that, gut health, right? So you hear a lot about gut health, and so we're going to be talking about, again, these common causes and problems in there. And, gut health is vital for our overall health. It's connected to pretty much everything. You hear a lot about gut health out there, and about 80% of your immune system cells are found within your gut. So if you have damage and symptoms going on in your gut, then it's going to be correlated and connected to your immune system as well. And then, I think a very important thing is that so many people have gut problems where maybe they do have indigestion, the heartburn, the acid reflux, bowel problems, diarrhea to constipation. And those symptoms are definitely inconvenient. They can be painful and disruptive to our life. But then in another way, they can be so informative that says, hey, something's going on here. And because this is our immune system, what does this mean? I'm on a path, like what type of path am I on? Am I leading myself to autoimmune diseases, cancer, bigger diagnoses where these symptoms are kind of like the first warning signals or the fire alarms that are going off. And I always want to coach and teach people to understand why that's happening and don't just treat those symptoms either with medicine or even something natural and then feel better and just call it good. Understand why it happened and know how to resolve the problem. Okay, so these symptoms can be beneficial to you in an approach of prevention and being proactive and not getting bigger and bigger diagnoses. So please always pay attention to symptoms. They can be more informational than they are like the cause of the problem. Okay, so when we're talking about, these three questions here today, we're talking about causes of heartburn, acid reflux, indigestion, bloating, any of these type of gut symptoms. What we want to start off with, number one, is that when we're looking at causes, we have to look at stress response in the body. So what does that mean is that, your body has to adapt to stressors, and there's three primary stressors that your body has to adapt to. And what they are chemical, like toxic stress. The second stress is emotional. And then the third one's a physical stress. So these stressors cause our body to adapt. And with enough adaptation, our body will degenerate, the cells, the tissues, the organs will degenerate. And now, once they've degenerated enough, now you can have a symptom. Now you can get a diagnosis. And so know that there's a sequence of events that it is taking place that is a pattern. That's something that's predictable that will lead you to a problem. And so we've got to understand that these chemical, toxic stressors, emotional stressors, physical stressors are involved. Like these are mechanisms that cause our body to degenerate and get sick. And so what are some examples of chemical stressors, toxic stressors? Definitely our standard American diet, ultra processed foods. It's not even real food. It's just a bunch of stuff put together in a box or a bag. It's not real food. That would include things like even the fast food industry, right? So another thing, the other stuff that's in our standard American diet, which the acronym for that is SAD, by the way, is high sugar. And that doesn't always look like candies and cakes and stuff like that. It looks like flour. Like we consume so much flour and bread, and that's a lot of sugar. The grains, lots of grains, even the oatmeal stuff. Artificial sweeteners like aspartame, right? Okay, so we don't have any calories in there, but now you're putting in this chemical that really damages our body. It's toxic. How about high fructose corn syrup? High fructose corn syrup it's like in all this packaged product, and the fructose to regular sugar in their ratios affect your gut a lot. You shouldn't be consuming this much fructose in the form that it's in. Bad fats, which are known as hydrogenated oils, like the vegetable oils, soybean, canola oil. These are terrible oils that cause a lot of inflammation and damage your gut. You got food colorings, all the dyes. There's tons of research and information about these types of toxins that and how they affect your gut, your health, your microbiome, which is all the good bacteria that's supposed to be in your gut and in your body. So there's plenty of evidence and plenty of toxins out there, unfortunately, that are part of the problem. Genetically modified crops are another one. And part of that's because they contain herbicides like glyphosate. And glyphosate is the technical term of that herbicide. And those cause antimicrobial results, meaning they damage microbiome, they damage good bacteria. They are very toxic. Pesticides, medications. We'll touch on a couple different medications again, like antibiotics and proton pump inhibitors is the technical term for acid blockers. We got tons of plastics out there, drinking from plastic, plastic containers. It's everywhere. Cleaning agents, like the Cloroxes and the disinfectants, the hand sanitizers. These destroy our microbiome and actually lead to more dysfunction. It's not protecting us. It's only actually making us more susceptible. Okay. We've also got environmental toxins like molds. My wife had mold toxicity, and that's how I got into and understanding functional medicine and became a functional medicine doctor. Heavy metals, it could be amalgam fillings in teeth, different medications again, different exposures in the environment. You can also have bug bites. And I think one of the ones that are most common that people hear about is Lyme's disease from a tick. And so that's a biotoxin that can really damage your body as well. So what we can gain from that is we start to understand that there's all of these triggers, there's all of these chemical stressors that can cause our body to adapt and damage us. Emotional stress, I think we all get that. But that stress does, it puts us into this fight or flight response, like you're getting chased by a bear, basically, is what I say. And it stimulates certain things in your body and it blocks certain things in your body. And one of the things that when you're in fight or flight, what happens is it actually shuts down gut function. Okay, because that's why I say if you're getting chased by a bear, you don't need to digest food if you're going to be the food, right? So you actually shut down the food, or you shut down your digestion, because other things are more important, like your heart beat, your respiration, your blood flow, your muscles working, because you got to get away from that situation. And even though this is an emotional thing, it's still creating that type of scenario. So you have to address that, and it suppresses these gut functions. And because your immune system in there, it'll also suppress your immune system function. So that's why you might hear in general where you say if people are stressed, they are more prone to get sick, like colds, flus, because it actually shuts down the gut and the immune system. So got to make sure we're addressing those emotional stressors in our life, work, relationships, some of the most common ones. And then we get to the physical stressors. That could definitely be accidents and traumas. But it's also like all of this stuff that I've already said, chemical stressors, emotional stressors, it causes your body to adapt. It shuts things down. It stimulates other things. And what it can do is when you keep that stress response going, the cells and the tissues and the organs start to degenerate. And in that degeneration, that also causes physical stress because those organs and tissues, they're not the same as they're supposed to be. And so that puts more stress onto the body because now these organs are becoming, dysfunctional. That there are like kind of think like a cavity on a tooth where they're growing cavities like on your stomach lining, like your pancreas, your gallbladder, your liver. Think of cavities growing on there, and whatever you want to call it, that's where you get to the diagnoses. But these organ cells and tissues start to degenerate. Now you got a compounding physical stress that will then therefore affect you as well. And then there's the other stuff like things that happen in medicine where they're removing organs because they become dysfunctional. Now you need a gallbladder. You can live without it, but in order to be healthy, you're going to need one. tonsils, appendix, ovaries. These are organs get taken out, and then that also creates a physical stress. Even though you're alive, which is great, but it's still going to put a physical stress on your body. And then, even some of the different treatments, radiations, MRIs, different again, medications, they can cause the physical damage to the tissues and then therefore be part of the problem. So let's always put that into consideration, understand that there's physical, chemical, emotional stressors that are driving our bodies to adapt and change. And with enough time of adaptation and change, now you've got problems, symptoms, diagnoses, and that's how you start to prevent this. But when we're looking at gut specific things, okay, so like, physical, chemical, emotional. Now let's move on to the next step is like, what are we looking at as most common causes of gut dysfunction and heartburn, acid reflux, bloating, bowel dysfunction? Well, there's a few different, there's many different categories here that I'm always looking at. And that's number one is digestive insufficiencies. Now, what does that mean? Is that, do you have proper stomach acid? Do you have proper digestive enzymes that are being released by your liver, your gallbladder, your pancreas? And this is to break down those macronutrients called fats, proteins, carbohydrates. The stomach acid is super important. It's one of its big purposes is to break down vitamins, minerals, proteins, and nutrients. And if that is not happening, then therefore you're actually creating a malnutrition, meaning you're not getting enough nutrition, even though you could be eating all the right things. You're not getting the proper nutrition your body needs because you have an insufficient amount of stomach acid, which is counterintuitive to what you often hear out there is that people have acid reflux and GERD, gastric esophageal disease, because there's too much acid. No, that's a degenerative process that's occurred. And now you have wounds that have occurred within those tissues. But what created that in the first place? Okay, so that's why that burning and that acid reflux can be there, or Barrett's esophagus, where things are swollen. And so you got to understand that stomach acid is super important for breaking down nutrients, vitamins, minerals, proteins. Proteins is a very big one because your body's made out of those materials. And also, stomach acid is something that neutralizes or kills off bad bugs that are coming into your body through food, or through your breathing, through what you're touching and you're putting your hands in your mouth. Like your stomach acid helps to kill that stuff off. And so if you suppress that stomach acid, then you're going to start to have more problems. Okay, so we're going to talk a little bit more about these acid blocking medications in just a moment. So so these deeper layers of dysfunction that I'm evaluating for a lot of people, or most people, is that number one cause of heartburn, reflux, bloating, digestive insufficiencies. And we're talking about stomach acid and enzymes. Second thing is dysbiosis. Now, what does that mean? Is imbalance in your microbiome, your gut microbiome. So you're supposed to have billions of good bacteria in there. And so sometimes when it becomes dysfunctional in there, those can be overgrown or they could be undergrown. And so I'm looking and evaluating, are there sufficient amounts of those bacteria that are pro health? You need them to be healthy. Okay. And so dysbiosis, that's what that means, is where are those bacteria, the good ones? Are they actually there? Are they overgrown? What is the status? All right. We need them to be healthy and strong. And I'll talk about some of the benefits of these when we're talking about antibiotics. The next thing I'm looking at is, bacterial parasite infections. And so there's these stealth infections is what we call them in functional medicine, and things like H. pylori to E. coli's to C. diff. Those are some big ones that people can have, different types of parasites. These infections are endotoxins, ENDO, which means internal, compared to exotoxins on the outside, like the glyphosate, the molds, the heavy metals, these things that we're getting exposed to from the outside. Once these bugs grow within the microbiome in the gut, now they're an endotoxin that produce inflammation, stress response, and keep perpetuating health problems. Okay, so the third thing, as far as common cause of heartburn, acid reflux, GERD, bloating, dysfunction within the gut, is bacteria, parasite overgrowth. And then from there too, also, small intestinal fungal overgrowth. So think of fungus, yeast, Candida, right? Everybody's heard of Candida, I think, by now. But Candida, these are yeasts. These are overgrowths as well, causing dysfunction within that microbiome. SIBO, which is small intestinal bacteria overgrowth. And one of the biggest causes of that actually is that when we're in the stress response, the fight or flight, it suppresses the immune system function and the gut function. So it slows down gut function as far as digestion. And there's something called peristalsis where there's a rhythm to the flow of moving bowel, like your bile through the bowel, right? And your stool through the bowels. And in fight or flight, it actually shuts that down and decreases it, so you don't have as much peristaltic activity. And so that is a big contributing factor to having overgrowth within the small intestine, which can definitely cause some bloating and discomfort in the upper gut. The next thing would be medication use, going to those antibiotics and acid blocking medications. So, therapies, medications, things that we use to treat in the pharmacology world, medical world. They do provide benefits in the right time. They do provide benefits. Okay. They can save people's lives even, but just because it creates benefits and saves people's lives doesn't mean that it's healthy for you. Okay. Because health and treatment and life survival is different stuff. And so we've got to understand that they can damage the health of your body. The next thing would be adverse food reactions. Okay, so that's where you get into topics of food allergies versus food sensitivities. I think I covered this last week. Again, there's different responses that your immune system can have to foods. Food allergies can definitely be a medical emergency where you need an EpiPen, and that's usually why medicine is actually just testing for those. And that's important, but you also need to know what the sensitivities are, because no matter what the reaction is, whether it's an emergency reaction or something that's damaging your health over and over and over again, it's all important, and you need to know what it is and what's happening. Is it broccoli that's causing the problem, right? So you have to understand that those food reactions are part of the problem too. And then also, coming back to the anxiety and stress, that stress response is huge, okay? Because a lot of people are in that situation. So what have we covered so far? Again, physical, chemical, emotional stressors. These are some of the bigger causes of what creates dysfunction. Once the dysfunction has occurred, these common causes of heartburn, acid reflux, bloating is things, digestive insufficiencies, dysbiosis, bacterial parasite infections, yeast infections, candida, fungal infections, small intestinal bacteria overgrowth. Medication use is another trigger, adverse food reactions, and then coming back to that anxiety and stress. So these are the common causes. And so the next question that we're planning on talking about here today is that the potential negative consequences of taking the acid blocking medications. They're called proton pump inhibitors, is the technical term for that. And then also the antibiotics on your gut and immune system. So with the acid blocking medications, again, the acid in your stomach is very much important. You need it to break down vitamins, minerals, proteins, nutrients. So if you take something to suppress that, you're actually creating a scenario where you're malnourished. You could be eating all the right stuff, but it's not getting digested and assimilated into your body. And then if that's happening, it's going to cause a whole ripple effect to so many other places of your body, right? So, and one of the biggest ones I see, because I take care of a lot of ladies with hormone issues, is hormones. Okay. And I think an easy kind of simple topic right there too is that tryptophan is an amino acid that you hear from turkey, right? And it's part of this. It helps with creating sleep. Right? And how does that work? Is that tryptophan converts into melatonin to serotonin and then in melatonin. And so if you don't have sufficient stomach acid, you could be preventing yourself from converting those amino acids into sleep. Okay. And so here somebody could be taking all these sleep medications and actually it's a stomach issue. And maybe they're on a proton pump inhibitor. See how this all gets to be connected. Another big thing about stomach acid, again, if you're suppressing that, is that stomach acid is designed to kill bugs off coming into the gut or even other toxins. Okay. So we really need that stomach acid. Now, when it comes to the antibiotics, okay, so antibiotics, again, they've been proven to save lives in different scenarios, but they are definitely overutilized for things that I'd say, in my opinion, for sure, because I've had the experience around it, that you don't need them. Okay. But let me go through this laundry list of reasons, like why we need good bacteria in there. And that's the thing about the antibiotics, is that it doesn't discriminate between what's good and what's bad. It just takes things out, good or bad. Okay. And to what degree, a lot of times that's not even being analyzed. You just have to, if it's not analyzed, you have to assume that you're killing off good stuff too. So let's talk about this. What are the health benefits? What is the benefits of having your probiotic in there? Like the good bacteria, not taking a probiotic, but having those good bacteria in there, is to prevent and reduce endotoxicity, meaning the toxins that come from the gut infections. Utilize fiber growth. Okay, fiber is super important for the growth and development of other good bacterias, and also eliminating toxins. What's another one? It's documented. Okay, it's scientific research. It's reduced risk of cancer. Okay, reduced cholesterol levels. How much cholesterol issues do we have out there? We have, improve. So if you have strong probiotic in there, the things that the bacteria that you should have in there, it helps with the mucosal barrier. Okay, this is the mucous membranes that are part of your immune system, and then also the tight junctions for leaky gut. Okay, so you don't want your gut to be leaky. The better your bacteria is in there, the better your leaky gut will be. The reduced inflammation, intestinal inflammation, and look at the diagnoses around that. IBS, IBD. There's so many different inflammatory diagnoses out there. It reduces the candida, the yeast. It improves the immune system response. What else is it we got here? So reduced allergic activity. So think from seasonal allergies to food sensitivities, all of that. Reduced autoimmunity, improved cell-mediated immunity. So tons of stuff around immune system when we have those good bacteria in our gut. So if we're taking antibiotics, it's just the opposite of that. It's damaging all of those things, or at least it has the potential to damage all of those things. And so we've got to be very careful about taking antibiotics. We've got to be very careful about using the hand sanitizers, the disinfectants, because that can also degenerate our good bacteria. So there's plenty of documented proof that you got to be very careful about antibiotics. So let's move on to the third question and finish up here, is that if you do have gut, or I'd say even immune system symptoms and conditions and problems, what are the appropriate functional medicine tests that would help to find the root causes, right? So I think a very simple one would be a food antigen test, okay? And it needs to be comprehensive, looking at the food allergies, the food sensitivities, all of them, and it needs to be done through the blood. That's actually an immune system test. By understanding what foods your body's reacting to, you can really take the stress response off of your body quickly with foods. But then from there, you have to look and understand what's actually happened to the gut in the microbiome, and that's going to take place with a comprehensive stool analysis. And one of my favorite things to use as far as a stool analysis is the DNA testing of the microbiome itself, not of your DNA, but the microbes that are happening within the gut. And in a comprehensive stool analysis, you're going to get a chance to see, are there infections? What is the health of the good bacteria that you need in there? What is the enzyme activity? What is the barrier function, like the mucous membranes? Do you have leaky gut? What are the inflammatory triggers, maybe like gluten or something? What does the environment look like, so you can specifically understand what are the triggers that are causing this? And that's the things that I've talked about from the very beginning. But then because of those triggers, how do we remove them? How do we regenerate the microbiome? And a lot of it is quit traumatizing it, right? With the stuff from the very beginning of this Q&A, and then go through a sequence, a scientific sequence of procedures, basically, that is well established for decades now, of how to regenerate the gut and the microbiome. Okay, and that's so really, when it comes to the testing, the first two tests that I would say would be appropriate for anybody at this point would be to do the food antigen test, and then also a comprehensive stool analysis, which is obviously taking a stool sample. So that's where I would start with that, because that's where you would get the chance to see a whole big picture of triggers, plus, because of those triggers, what actually has happened within that gut in the microbiome. All right, so that's it for today's live Q&A. If you do have questions, please put them in the comments. You can also email me at info@drgunyon.com. That's info@drgunyon.com. Look out for these live Q&As every Wednesday at 12:30 Mountain Standard Time. And so I'll be posting information about next week's live early next week. So keep an eye out for that. And I will look forward to seeing you soon. All right. Have a great day.